morning and welcome to another program of Light and Life, coming to you from Melbourne, Channel 31. Next is Kingsley talking to Bandu about some latest findings in science and technology, and related fields are the subject matter.
Bandu, up to now, I have, like most people, have been under the impression that one of the biggest culprits from a dietary point of view for high blood pressure or hypertension was the intake of salt. While, yes, salt intake for high blood pressure is not good, now scientists, the researchers have found that there is a bigger culprit or equally big culprit in the dietary field than salt, and that is sugar. Now, I was surprised when I read that article because what they say is that the intake of sugar, can be one of the primary causes of increase in hypertension or high blood pressure.
Right. So usually what the common people think is that intake of salt is a major contributory factor in the hypertension, increase of blood pressure.
This is actually an eye-opener because hypertension is associated with cardiovascular problems, and it is, as you know, is the main cause of premature deaths in the Western world. So, of course, they say they don't eliminate the fact that salt intake is bad for you, that in fact salt intake is bad and excessive salt intake. But the average reduction, they say, in the blood pressure achieved by restricting salt intake tend to be relatively small.
So we can have a bit of salt in our fish and chips.
Actually, and there is some evidence, they say, to suggest that 3 to 6 grams of salt daily may be the optimal for health. Right. And that an intake below 3 grams may be actually be harmful. Now, I was surprised when I read that because most people think that you cut out salt completely and you're okay.
Yeah.
Now,
usually, Kingsley, we always think that salt is an acquired taste and we don't need salt, and you get enough from all the other intake that.
But really, according to this study, Bandu, there is a relationship because more salt in the diet comes from processed food.
Right.
Now, which also happens to be a rich source in added sugar.
Right.
So they say, yes, this sugar intake, in particular, monosaccharide fructose, that is fruit sugar, which is sugar you get from sugar cane, so sugar beet, and corn syrup. Now, most of the fizzy drinks, I'm told, the added artificial sweetener is corn syrup. And we find that is in itself is a problem.
So what it boils down to is the complex sugars we take from natural fruit and other sources is good enough, and also that salt is a necessary thing.
Salt is a necessary thing, but of course, we have to be careful with these studies that, we don't, they don't recommend that you just suddenly increase your salt intake because that could be bad, right? So, the old belief may not be wrong, but something which is an eye-opener is that sugar intake has to be also restricted. Do you know that the daily intake of more than 74 grams of fructose is associated with a 30% increase in the blood pressure, where the blood pressure is 140/90.
Okay.
And 77% increase in the risk of blood pressure is above 160/100. So something you need to be careful about is
So
this.
the bottom line is sugars are more harmful than salt.
Yes.
Okay.
Of course, we got to, this is only one study.
Yeah.
So, why, we shouldn't jump at conclusions, but something to keep in mind.
Yeah. Okay, Kingsley. So, what's the next item?
Well, the next topic is something which is common to most people, and particularly a person I know is having these knee pains. And you know that arthroscopic surgery is what normal recommended thing for knee problems. Now, you know that when I made the study, because this person who told me about who's suffering from this knee problem is in constant pain.
Yeah.
Now, of course, painkillers help, but only temporarily. Now, the doctors have recommended that she undergoes or thinks about arthroscopic surgery.
Right.
Now, I made a study of this thing. Now, knee problems are generally caused by meniscal tears. That is, the meniscus is a cartilage which is at the knee here. It is the one which is between the thigh bone and the shin bone,
right.
and it acts as a shock absorber.
Yep.
Now, that it can be damaged, or there can be a tear due to sports injury or physical trauma, or even due to degeneration with the passing of age.
Yeah.
And the normal thing is that the arthroscopic surgery is recommended. But the thing is that they have found that in some patients that having undergone this surgery, they can, and some have, developed osteoarthritis and cartilage loss.
Other
complications like osteoarthritis and cartilage loss. So this study says that an alternative to surgery is what they call conservative management. Now, conservative management is physical therapy, which is to maintain the strength and restore the common problems with the muscles. And the other thing is, they also say that maybe ice packs should be considered, and non-steroidal anti-inflammatory medication.
Probably because your reading is in Western journals, did they talk about any oils and Ayurvedic type treatment?
No, actually the thing is that when you look at these studies, I mean, you got to keep an open mind. You just don't go on one study, or just because we discuss it, people don't rush into things and say, okay, surgery is not for me type of thing. They got to sort of weigh the pros and cons and see how it goes and consult the doctors, because invariably the doctors will do the right thing.
Right. So maybe surgery is not the thing to jump at, but usually you can, if you can cope with your day-to-day affairs without doing surgery, it's much better, right?
Yes.
That's all we have time for you today. Till we meet again from a similar program next Tuesday, I am Mihiri Disanayaka.